Welcome to the Coronavirus Weekly Brief. We're your hosts. I'm David Sterman.
And I'm Emily Schneider. Here are the headlines you need to know.
On Sunday, Johns Hopkins reported a 7-day rolling average of 87,845 U.S. COVID-19 cases. The first time the number has dropped below 90,000 in the U.S. since November. The drop may be in part due to rising immunity as more people receive the COVID-19 vaccine. However, Dr. Tom Frieden, former director of the Centers for Disease Control and Prevention, says that the more important factor in the drop in cases is likely mitigation efforts, like mask wearing, avoiding crowds, and physical distancing. Seasonal trends may also be influencing numbers, as similar viral infections tend to spike in early winter and taper off as the winter continues. Dr. Rochelle Walensky, the current CDC director, says that while case numbers are dropping, quote, they're coming down from an extraordinarily high place, unquote, and mitigation efforts remain important.
According to a new study published Sunday as a preprint ahead of peer review, researchers have identified 7 new coronavirus variants originating in the United States. The mutations all occurred in the same position in the spike protein, a protein that helps the virus infect human cells. Because the mutation occurred multiple times in the same place, the researchers suspect that the mutation may give the virus some evolutionary advantage. However, there is no evidence yet that the new variants are more infectious or more deadly than the original strain, or that they will become a major concern.
Another new variant, designated B.1.525, was discovered in the UK with mutations similar to strain B.1.351, which was first discovered in South Africa and may be resistant to vaccines, in addition to being more contagious. It is unclear whether the new strain will behave in the same way as the B.1.351 variant. Currently, the strain does not seem to be spreading faster than other strains, and is present only at low levels in the population.
South Africa is planning to share its 1 million AstraZeneca COVID-19 vaccine doses with other African countries, as the first shots from rival pharmaceutical company Johnson & Johnson arrive. The country paused the rollout of AstraZeneca doses earlier this month after a preliminary trial showed they offered minimal protection against mild to moderate illness from the B.1.351 strain of the virus, which has now become the dominant strain in the country. The South African Medical Association said if the first doses of the Johnson & Johnson vaccine arrived on Tuesday as expected, then vaccinations could start today. 80,000 shots are supposed to arrive in the first shipment, all of which will be used to vaccinate healthcare workers. Anben Pillay, Deputy Director General of the Department of Health, said South Africa planned to share the 1 million AstraZeneca doses it received at the start of the month from the Serum Institute of India via the African Union. Quote, the doses are going to be shared with countries on the continent via the AU, end quote.
On Tuesday, the Siena College Research Institute released a poll finding that New York's Democratic Governor, Andrew Cuomo, remains popular despite the state's Attorney General releasing a report finding that he had undercounted nursing home deaths in the state. The poll was conducted from February 7 to February 12, while the report was released on January 28. Politico writes the poll found 56% of respondents said they view Cuomo favorably, compared to 39% who view him unfavorably. That's basically the same as the 57.39 he received in January and 56.39 he received in November, unquote.
On Tuesday afternoon, the Biden administration announced that it would extend the federal ban on foreclosures and the allowance for delayed mortgage payments through June 30th. According to Politico, the actions would block home foreclosures and offer delayed mortgage payments until July, as well as offer 6 months of additional mortgage forbearance for those who enroll on or before June 30th. The CARES Act, signed by President Trump, provided protection for 12 months, which would run out in March. The Wall Street Journal writes, quote, some 2.7 million homeowners have active forbearance plans, representing 5% of all mortgage holders, and more than half of the plans are set to end for good in March, April, May, or June. According to mortgage data firm Black Knight, Inc., the White House noted people of color are more likely to have deferred or missed mortgage payments. To see our daily brief, go to the address in our show notes and follow us on Twitter, @NewAmericaISP.
The Coronavirus Weekly Brief was produced by Shannon Lynch and Jason Stewart and was edited by Shannon Lynch. The podcast is brought to you by New America and Arizona State University.